Hello, I'm Dr. Paul Beckham from All Seasons Integrative Health in Fargo, North Dakota. We are going to have a series on our reverse neuropathy program, and today is day one. So, this is an introduction to our reverse neuropathy program. Let me just give you a little bit of an overview here. Again, hey, I'm Dr. Paul Beckham. I'm a chiropractor, certified chiropractic extremity practitioner. I've been treating neuropathy for over 10 years. So this is something that I want to make sure that the public, if they do have neuropathy, we get it dealt with as quickly as possible, and especially if you're on that critical or extreme end of the spectrum, we're being as aggressive as possible here at trying to get it reversed for you, so that you don't end up having to suffer the dire consequences of possibly even having to have limbs amputated, which that would be the worst case scenario. So, our clinic's mission is to help people finally feel good and live their full potential. We can do that by, with our reverse neuropathy program here, helping to, restore their feeling back and help diminish some of the symptoms that they're having from their neuropathy. Our core values at the office, our leadership. We want to make sure that we can help, lead you uh, basically on the path, and we'll get into that in a little bit here too. That's an acronym that we use in our office uh, to finally feel good and live your full potential. We do this by simplicity, by helping to just try and explain things in a very simple and straightforward manner so that you can understand what is going on, especially after we have you evaluated to determine exactly, one, do you have neuropathy, and if you do, exactly where does it rate in the severity scale, and what are we going to have to do for treatment so that you can make an informed decision as to whether or not you want to move forward with the treatment or not. And also, freedom is the ultimate thing here. Like I say, we want you to finally feel good and live your full potential so you can, have the best quality of life you possibly could have. So, today's focus is going to be on the benefits of our reverse neuropathy services. So let's get into kind of understanding, what is neuropathy. What is neuropathy? You've probably seen in this diagram here. It might be a little bit hard to see, but if you see there's three nerves on the left-hand side of that diagram. The top one is normal, where you have the proper blood flow. The nerve is nice and healthy. The second one, you're starting to get a diminished blood flow there, where the nerve is now, starting to be affected, and you're going to start to get some of the symptoms. And the third one is where, hey, you've lost all the circulation to those nerves. And it's, at that point where you're in that critical or extreme end of the spectrum where we need to do as much as possible here to try and help reverse that. And, that'll be due through typically three different means in our office. There's going to be in-office treatments. There's going to be at-home treatments as well as diet and nutrition changes that are going to help you reverse your neuropathy. So, what are the causes and risk factors here? Well, the main causes, or the biggest cause, is diabetic neuropathy. So, if your blood sugars are getting out of control, that's where you start to have the problems with that blood flow starting to get diminished, because the sugars in your blood just don't allow your blood to circulate properly there. So, obviously, if you have diabetes, whether that be type 2 or type 1, you want to make sure that you're keeping your blood sugars under control to help maintain that proper blood flow that gets out to those nerves. Other things it could be is vitamin deficiencies. It could be you're actually taking medications that actually are causing it. Chemotherapy would be one that would cause a neuropathy. And the weird thing is, even the medications that they do give people for neuropathy can cause neuropathy. So that's where some people get stuck after a while. They start to take those medications, and typically what I see in the office, it might be a year and a half, 2 years. They're already on the max dose of the medications, And it's just not getting any better anymore because one, they're just covering up the symptoms, and two, it might even be side effects of the medication. It's kind of hard to say. Also, alcohol can cause uh, neuropathy. Typically, it's actually causing a vitamin deficiency. So there's lots of different things. This isn't all inclusive. Some of the other things I'll see with patients in the office are even just heavy metal that can cause problems, which could come from chemicals that they're exposed to. In our area here, it could be farmers and just the different chemicals that they're using for herbicides, pesticides, and all that sort of stuff on their fields. So we're getting into an overview of our reverse neuropathy services here. And basically our clinic has a holistic approach to health here. Yes, we want to get your symptoms to go away, and really that's kind of what traditional allopathic medicine does well, is acute care services. But the problem with peripheral neuropathy is that it is a chronic condition, and that's where they just kind of fall short, and then you end up waiting to have things done. You're waiting to have your limbs amputated. I mean, that's a horrible picture here. So in our office, we're going to evaluate you first to determine exactly what do you need. And it's also your option. You can choose to have or not have certain services, but if you want to get the best results, you're going to want to follow through with the recommendations that we give you. So those recommendations would be, diet, nutrition. If we have people on the mild end of the spectrum, they might even be able to just get away with that, and we can get them back in to get them evaluated, probably 90 days down the road. Once we start to get up into that mild to moderate, definitely into the moderate category, then people are going to need even some at-home treatments. We'll get into those briefly here. And then we get into the people, from that moderate up to severe to critical or extreme. And they're definitely going to need some of that in-office treatment because it's just a little more heavy duty. We're going to be able to get that blood circulation coming back. Some of the therapies that we have in our office were actually originally developed to help restore blood flow to people that did have diabetic ulcers. So that should be coming up in the next few slides. Our clinic, we have what's called the PATH system or PATH protocol, where, hey, it's a proactive approach to health, but it's personalized clinical treatment. So, again, we're going to evaluate you to determine exactly what you need for treatments here to help reverse your neuropathy. Yes, people are going to, heal to varying degrees, but typically, the more aggressively we treat it, the better results that people are going to see. The A in the acronym stands for adaptive care. We're going to adjust your treatment as you go along. Typically, the people that have that moderate to extreme types of neuropathy here, we're going to be evaluating them on a monthly basis in the office as they're going through their treatments, so we can see, are they getting better or not. We want to make sure that we can adjust your therapies as soon as possible here. We don't want to wait too long. Even though neuropathy is a chronic condition, we want to get you better as fast as we possibly can. Also, targeted dietary solutions. There's questionnaires, which could lead to possible blood tests or urine tests that would help us determine more specifically what you might need as far as dietary changes. Typically, it's an anti-inflammatory diet, but then there's also very specific supplements that we're going to use. There's even some saliva tests that we do use in the office to determine whether or not you have enough nitric oxide in your body, which that's a huge factor in restoring that blood flow to heal those nerves up. And then the last is the holistic wellness approaches here. So we're not just going to focus on just the pain, because if you chase the pain, you're never going to fix the problem. And we want to get down to the root cause of the problem to help get it resolved for you. So, what are the different levels of service in the office here? We have 5 levels of service, basically dependent upon the severity of the neuropathy and what we're finding in the office here. It could go from like I mentioned before, minimal to mild to moderate to severe, and then up to that critical, or some people might call it extreme level there. In all of that, we're assessing your sensory system to see how you're feeling things, your motor system just to see how your body's functioning, as well as we have a computerized test to test your autonomic system to see how much of that is affected. So that way we're catching all of the peripheral aspects of the nervous system here, and we can make sure that we're designing a treatment plan to help get any and or all of those areas dealt with. So let's get into the next slide here, because that's going to get into, again, we have not only in-clinic services, we have at-home services, as well as the diet nutrition services. Some success stories here. We have a patient, even just within 1 month, his left foot, as far as his sensory went, was 12% better. That's 12% better on the scale. So I can't remember exactly where he was at. We should probably have that number on there. But doing much better. He's down into the moderate range, was closer into that severe end of the spectrum. And his right foot was 28% better. So again, that was just within 1 month of care. So that's the direction we want to see everybody heading here. On the other side was some exam forms that we have for a patient here, and they went from the 30s and 40s down to, it was like 13 and 0% sensory loss here over the course of their treatment. So that's, again, where we want to see everybody headed here in the right direction. So on the screen here, now I have some of the in-office therapies as well as the at-home therapies that we use to help reverse your neuropathy. The first, when you see the kind of the massage bed with actually a big therapeutic cushion, that it's called PEMF therapy. Most people we do have sitting in the chair. We'll even have them put their feet, usually have that footrest even flipped around, have their feet on the footrest there to help stimulate uh, the blood flow, or basically help stimulate the tissues, I should say. And the PEMF therapy is what was originally developed to help improve or heal, I should say, diabetic ulcers. There's some very interesting studies from companies in Germany. We had a previous unit, it was more a low intensity unit. It literally, when they tested people, where they can test people live during surgeries and all that, you can literally just see the blood flow improve just 15 minutes after they applied the therapy there. Probably the biggest therapy that helps is the one that has the screen where you can kind of see like a graph on that. That's our K laser here. It's a high intensity laser. It's a 100-watt laser. Our current laser, the K laser special, now we can treat people that have neuropathy in about a 12 to 15 minute time frame, maybe give a little bit more, a little bit less. Whereas our previous laser, which was a 20-watt laser, which is a common one that's out there now, would take us over an hour to do the proper therapy on the patients. That's if they had both their hands and their feet affected. If it was just like their feet, it would take about a half an hour to do the therapy. For people now to do their feet, it maybe takes 6 minutes. Usually we're treating them from their spine all the way down to their feet because we want to stimulate the nerves where they exit the lumbar spine and travel all the way down the leg to the feet. The therapy that's down in the bottom left-hand corner there is a focused shockwave therapy. That's where some patients will notice a huge difference within even the first few visits, because they're literally seeing that their sensory is coming back quite well. They'll even notice that their balance, if that has been affected, is improved. They'll feel like they can walk on their feet. Their feet won't feel like, I've had some people describe it as like hamburger, or they can feel like they have a sock balled up underneath their foot. Uh, but we can get their sensory back fairly quickly with that. Um, Usually that's just used during the first 90 days of a person being treated there. The laser is the biggest thing, because that actually helps to improve and helps to restore blood flow, uh, even healing and creating new blood vessels, angiogenesis. as well as healing the nerves. And we'll get into that in future days here, so we can get into that in a little bit more detail. And we'll get into a little bit more detail with the focus shockwave and the PEMF therapy as well. So their at-home therapy is literally nutrition, and everybody's different. You might not necessarily get what I have on the screen here in that top right-hand corner there. But again, once we know exactly what you need, we'll make sure that you get exactly what's going to help you in reversing your neuropathy. There's an electric stim unit here. It's not a TENS unit. It's a therapy that actually runs at a frequency that's very similar, or that we can run on our PEMF therapy. It was developed by NASA to help heal wounds in space. And what it does is it helps to normalize the nerves again. And it helps to get that sensation back without using drugs or surgery. The Freedom 300 is a light therapy, the anodyne therapy. That is something that, again, that you can run at home. And that literally is a light therapy that helps to stimulate that blood flow as well, kind of similar to our laser. It's only one frequency. Our laser's got 5 different frequencies to it, so it's hitting a lot of more things with the in-office treatment than just doing the one at home. Again, when we start to look at that severity scale and how people are affected by neuropathy, that's going to determine, just exactly what we need to use for therapies here. So, if you have any questions, we're gonna have this is obviously going out live here. Please ask the questions in the comment section, and I'll try and address them as soon as possible here. We'll probably be reposting this at various other places, including YouTube, as well as our blog on our website here, so people can go back and watch this whenever they would like. Again, we will have a series of 30 videos here, hopefully covering everything that people could possibly need to know here about the neuropathy treatment in our office here. And again, if you have questions, please feel free to ask those questions so that we can answer those, or add on some additional videos here to address all those questions as well, so that way other people can benefit from the questions that you have. As far as closing remarks, hey, again, the main points that we kind of discussed here today is, neuropathy. I mean, it actually can be caused by many, many different things. And that's why we want to do our evaluation here to determine exactly just how you're affected. We're going to look at that from a holistic health perspective here. So we get down to the root cause of the problem, and then we can develop a customized or personalized treatment plan for you to help reverse your neuropathy. So, what do you need to do? If you think you have neuropathy, or you're just wondering if you do, just book a consultation. During that consultation, we can at least determine maybe if you have neuropathy or not. We can take you through some screening procedures and see if any further, testing is warranted here to determine, the exact severity and exactly what maybe would be needed to help treat your neuropathy. You can schedule that consultation by calling 701-356-0016, or you can shortcut to our website or to our reverse peripheral neuropathy page here, is just www.fargopn, so FARGOPN.com, and that'll get you right to our reverse neuropathy program page. And you can even dig in a little bit further. There's plenty of information there. I'm sure we'll try and link some of these videos to that as well. So if you do have questions in the future, hopefully what we'll be addressing in these videos, you can find that just by clicking on a few different links here. We do have some special offers at this time. Don't know how long we'll continue to offer them, but at least right now, if you want to come in for that, excuse me, let me just roll this back a little bit here. We do have free in-office workshops. They happen on a bi-weekly basis here, and you can go out to our website and basically schedule yourself for one of those workshops. So check out those dates there. This is completely free, so if you have further questions you want to have answered before you want to commit to anything else, you can come into that. It's absolutely free. If you want to get evaluated to determine, do you have neuropathy or not, you can come in for that $49 initial consultation there. It's a value of approximately $499 here to just determine, do you have neuropathy going on? Is it something we need to get evaluated further here to see what kind of treatment we could be getting you on to help reverse that neuropathy? Or if you think you already have neuropathy going on and you just want to get right into it, we do have a $199 special for a VIP exam to determine the severity and get some baselines for your treatment so that we can go over your treatment. Again, we'll outline that completely for you as far as then what you might need to be doing in office, at home, or with nutrition, and just how long it might take to get this neuropathy reversed for yourself. And we'll go over that on a follow-up visit so again, you can determine if you want to follow through with the treatment plan or not. So I hope all this information helped. Thank you for watching this video, and hopefully it's not a goodbye. Hopefully it's a hello, and you're actually reaching out, and we can get you evaluated to see if you have neuropathy and see if there's something we can do to help you. So the next day's topic here right now is going to be understanding neuropathy and its symptoms. So we're going to get into that in a little bit more detail. Also, make sure to follow us on our Facebook page so you can stay tuned for more health tips, and obviously catch the following day's reverse neuropathy videos here so you can get a better understanding of just how you could benefit from our reverse neuropathy program. I hope this helps and hope to see you soon.